And we're glad that you're able to join us even at this late hour on a Friday. And we look forward to your questions if you have any that you have prepared beforehand for our today's topic. So for today's topic, we'll be discussing the strategic information technology planning framework for hospitals, something that's very near and dear to all of us, I believe, and will be very helpful for us in the long run as we try to really come up with a strategic roadmap, IT roadmap for our healthcare facilities. So, without further ado, I'll go straight to introducing our main speaker for tonight. He is the CEO and founder of Med Projects, which is a health IT company, and he has been in the business specifically for health IT for almost 20 years now. Lots of learnings over the years from our speaker, and really something the nuggets of wisdom that we get from him during his lectures, hindi po matatawaran. So our speaker for tonight will be the immediate past president of HL7 Philippines, Dr. Michael Mewin. Dr. Mike.
Nakamute pala to. Good evening, everyone. Okay, so let's start. So I'll be talking about strategic planning framework for hospitals. For most of my professional career, I've been working in hospitals. So I implemented HIS, EMR. Okay, so along the way, I've been trying to come up with ways to work better, smarter, and faster for hospitals. So one of my learnings when it comes to hospital IT planning is that sometimes what we call strategic is not really strategic, no? Sometimes we just end up just buying what's available. A good IT strategy should support the business. Okay, so it's important that we align with the business. Okay. Parang meron ka lang i-mute. Okay, so the first task when it comes to strategic planning is to align with the business goals. So you need to understand what your hospital wants to do. Okay, so ano ba yung core business? Is it a specialty center? Is it ambulatory clinic? Is it a multi-hospital network? No? So you need to understand that one. You need to look at the improvement projects, yung growth targets, ano bang gusto sila mangyari, ano gusto sila ma-achieve, saan sila papasok na market, no? At ano mga innovation plans. So yung mga ibang hospitals meron ganun, innovation plans. Okay, the second is to know where you stand, no? You need to assess kung ano yung meron ka. Sometimes we get parang nadadala tayo sa mga pangarap natin na we want this one, but it's important that we need to understand where we are, what our key stakeholders want, and then we need to be realistic, no, with our budget. Yan ang pinakamalaking resource and constraint natin when it comes to the IT projects. Okay, so let's dig into the framework. Screenshot time. You can take a screenshot of this one. This is the framework. I've shared this framework with other CIOs, and other CIOs have used this as part of their planning. No? So whether it's multiple hospitals, small hospital, big hospital, they can actually use this for some of their planning. Okay, so this is I developed this in the 20 years that I've been doing hospital IT work, and it helps me come up with a plan na medyo complete. Okay, so let's go through the framework. We start at the top. It's actually a 3-year roadmap, no? But it could be just 1 year, depending on the planning of the hospital. It can be 5 years. But usually 3 years is doable, kasi usually if you look at the different IT projects inside the hospital, some will take 6 months, 9 months, up to 18 months, no? So if you want to plan sequentially, kung paano sila iplano, usually abutin ka ng mga 2 to 3 years. So that's a good parang range, napansin ko. But this is flexible. You can adjust depending on your requirements. Tapos, depending on the roadmap, This is not a project timeline, no? This is a roadmap, a framework to plan. So I usually put Q1, Q2 because it allows the hospital to budget. Sa Q1, meron tayong 3 projects. Sa Q3, meron ganun, no? Okay. The first input that I do on the first line, you could do this in a Word format, no? This is an Excel. Sa Excel, konti lang space, but if you transfer it in a Word format, mas malaking space. You actually put ano yung business targets. You start with that. So sabihin natin, ang plan ba ng hospital is to build a cancer center, to go to build a home-based care network, no, or services, no. You need to look at those business side requirements and then put them there. Kasi it would make sense if you go yung i-review mo na yung plano mo na bumabangga ba sa business, no? So if, for example, if the goal is to build a cancer center along with the heart center, no? Pero wala ka ni isang plano doon sa IT side on improving cancer services, cancer registries, or adding cardiac integration, no? So hindi siya nag-align. Okay? So that's why you need to put business strategies as first. Second one, I usually try to identify ano yung mga specific themes and focus ng IT. Dito, kailangan medyo honest kasi sometimes there will be years na magsabi ng hospital, it's time to cut costs, no? Lower our cost, ito lang kaya natin na budget. Okay, so realistic na dito mo ilalagay kung ang focus mo ba is puro hardware, improve the data center, wala mo ng software products, iisa lang muna yung product, or is it time that we get out of on-prem, move to the cloud, no? Dito, it adds some context on the IT side. Kung ano yung mga constraints, ano yung budget, ano yung focus. Okay? But the meat of the framework is actually these 10 hospital IT domains. When I started working many years ago, 2006 in St. Luke's, and I was building roadmaps, no? 4 lang ito na domain, but as years went along, it became 10. No? It was clear to me that some domains needed some focus. Okay, so we'll go through each domain one by one. Okay, so the first domain is actually the core transactional system. So ito ang start agad ng lahat. Almost all hospitals will start with this one. The core transactional system is the one that captures, initiates, and records all the core financial transactions of the patient journey. Okay, patient and the transactions niya. So that's the core, because that is the business of the hospital, to deliver patient care and then in exchange for money, diba? So ang mga sample IT systems na nandyan sa core are the HIS, kung clinic is the clinic management system. Sometimes hindi na-appreciate na the clinic management system also has billing, no, inventory, no, mga ganon. Basic financials. And there are a lot of modules, lalo na kung hospital ka, there are a lot of modules inside an HIS. So doon papasok yung admitting,
Dr. Mike,
nursing. Yes.
sorry to interrupt merong kang on the right hand side na natatakpan ng previous slide. Maybe you can unshare then reshare.
On the right-hand side. Okay. So ito.
Ito nawala na eh. Okay.
Hindi kasi yung
Baka lang
yung
maulit eh. Sige.
Okay.
Sorry.
Yung chat box ng Zoom. Okay. Okay na, malinaw
Okay,
na
sir,
lahat.
go ahead.
Okay. So a part of the HIS, even if we see one core transactional system, there are a lot of modules inside it, no? So doon papasok yung admitting, patient registration, the different units inside the hospital, yung outpatient, yung ER, cashiering, dietary, marami papasok doon, no? The core transaction is one of the biggest systems inside the hospital. You even look at bed management, no, room reservation, housekeeping, no? Lahat yan papasok. Ordering, so paano ka mag-capture ng orders from charges, from one order ng cotton balls to supplies, no? So sa lahat ng kina-capture yan. Inventory, part yan ng core transactional systems. Okay? Yung pharmacy, hindi natin syempre pwedeng kalimutan yung PhilHealth. PhilHealth is just a big part of our core transaction system. Doon ang umpisa, minsan yung eligibility tini-check hanggang sa dulo kung paano ka mag-submit ng mga CF4 and mga records mo. And then of course, the billing side, that's part, no? So maraming mga problems lumalabas sa billing sa mga pero malaking problem siya pagka merong bottleneck doon sa discharge process sa billing side. And of course, our DOH requirements. This is part of our LTO, license to operate. So malaking bagay na merong DOH annual statistics, kasama ito sa ating core transactional systems. Okay. So just one, we're going to 10. So this is the first one. When it comes to core transaction systems, the thing to remember is that it should support all your services. There are times that what you have, whether it's an HIS, a CMS, medyo kulang, lalo na if you go into services na hindi part ng usual hospitals. Meron dito yung industrial medicine, yung idea na you go into pre-employment, you go into yung mga seafarers, or mga pre-employment. Kung meron kang corporate clinic na requirement, ibig sabihin may mga doctors ka sa loob ng mga companies, meron kang ambulatory centers na nakahiwalay, paminsan sila remote o off-site sila, sa ibang lugar sila. Meron kang urgent care, iba yung model, one-stop shop, So you need to understand all of your core business services and then assess it with your core transaction systems. What's important is it should capture all financial transactions as much as possible. Dapat 100%. Wala yung tipong as much as possible captured in a digital way. Wala yung tipong merong papel lang tapos ino-OR lang ng papel, inaano sila. As much as possible digital and captured and goes into the system para ma-assess and mag-feed into the financial side. Okay, so the core transaction system introduces efficiencies in the different aspects of the patient journey, and for the business side, it gives you a sense of where you are, the business. Okay, the second one is the operational support system. This is what I call the non-clinical. It supports hospital operations, business processes, and other non-patient related activities. When I started out coming up with the framework, there were just two to three, So meron yung HIS, meron clinical at meron non-clinical. Okay, so but it grew. So let's go into the operational support systems. The sample IT systems here are actually the ERP. The ERP, merong financial sa loob ng HIS, but an ERP looks at the bigger aspect ng business. Okay? So ito yung mga tipong meron ka pang rent, meron kang medical arts building, meron kang parking, Depende sa business model ng hospital. Sometimes may pumapasok, dumadami yung chart of accounts, so doon ka titingin sa ERP systems. HRIS, of course, you need to manage your people. Customer relationships, ito yung mga kinukuha mo yung for marketing and sales, Help desk, ticketing, this is kung malaki na yung IT department mo and you need to manage the different problems, issues inside the hospital. You also look at document management systems that allow scanning of policies, contracts, Sometimes kailangan yan, mga legal side. Okay. One of the most common questions I encounter, I'll try to look at this kasi it's ERP is one of the biggest things na kino-consider lagi ng mga hospital. Do I need to buy a separate ERP or do I just need to look at the financial system inside the hospital? So one of the common parang criteria of looking at it is if you need to incorporate best practices of accounting and you have multiple sources or hospitals or units that you need to track and put in marami-rami chart of accounts, then you might need to look at an ERP. Okay? So yan yung isang criteria why you need to look at an ERP because it allows for the different departments to manage with their cost centers, no revenue side. However, if you are a single hospital and you are actually constrained just by the ability to look at data, to crunch data, then you don't really need an ERP. What you need are better reports. So you need to understand, do I need full accounting best practices or do I just need better reports? If you just need better reports, then you look at data analytics side, yung reporting side, not buying an ERP. Okay. Another one on the HRIS, you just make sure that when you do reviews of HRIS, you get to look at how they manage the PRC licenses, the training, kasi malaking bagay ito sa mga hospital. No, yung mga training certificates nila, every year, may mga training yung mga nurses natin, mga doctors, mga ganun. So, kailangan tingnan yan. We even look at performance evaluation as part of the HRIS. So, pinapasok yung kanilang mga grade in performance reviews. Okay? So, when it comes to the operational support systems, you look at your hospital, you go around and you look at these areas na marami talagang papel. No? So, ito usually ang napapabayaan eh. You go to the medical records, maraming papel. You go to accounting, maraming papel. Purchase department, maraming papel. Kung ganun na ang nangyayari sa hospital niyo, and there are departments that already have a lot of papers, no? Yung mga tao, ganito nakataas yung ano nila, yung paperwork nila, hindi mo na makita yung muka. So, you look at it, I think this is an area that requires an operational support system. It is not patient-centric, but it allows streamlining and efficiencies in the hospital. No? If you look at operational efficiencies, that's one area. You look at less paper for all the areas in your hospital. And as part of the benefits of operational support systems, you get a leaner staff, more productive output, and less paperwork. Okay. The third one is the ancillary and department systems. So this is actually pretty easy because if you're a hospital, you have a lot of this. These are the departments that provide diagnostic tests, procedures, interpretations, medical imaging, and other ancillary services. No? It's easy to identify because these are the revenue centers. Ito yung mga binabayaran ng pasyente sa loob ng one of the areas na binabayaran ng pasyente. So ang sample dito inside the hospital will be PACS. The PACS system is the storage of medical images. You have the laboratory information system, cardiology, PACS ECG, ophthalmology, no? Lahat ng different departments that provide ancillary diagnostics, no? Sometimes, depending on the training or the background ng IT manager or hospital CIO, they don't appreciate na napakaraming ancillary systems, actually, ancillary services sa loob ng hospital. So, kumuha lang ako ng screenshot ng Siemens. No? This is just one way to help appreciate the range of diagnostic services. So, even in medical imaging, you have angiography, ultrasound, no? CT scan, MRI, mammography, C-arms. No? So, marami na sa loob ng hospital, maraming nakakalat dyan just on medical imaging. Laboratory diagnostics, marami rin. No? So, may mga assays, hematology, yung mga drug test, clinical chemistry, andyan yan. Di ba mapasok yung mga cardio, nuclear medicine, no? Maraming services sa loob ng hospital na paminsan hindi napapansin. Yung mga audiometry, mga pulmonary test, no? So andun sila sa It's easy to identify because these ancillary services is one of the biggest source of revenue in the hospital, and it is also the biggest source of clinical data. Automated and generated clinical data. CBC pa lang, mapupuno ka na ng papel. CBC, urinalysis, fecalysis, blood chem, x-ray. Kung ganun ng operations na, even the diagnostic centers, napupuno sila ng data. No? Just imagine the number of data na napupuno din sa mga ancillary services. However, it also gives 40 to 60% of hospital revenues and profits, which is actually good because yung areas na to, it's easy to justify cost in these areas kasi sabihin lang na if we buy this system, it allows for better operations and gives better revenues, no? Kahit na gumastos tayo ng 2 million ngayon for this system, but actually after 1 year naka-ROI ka na, and then the next year mas malaki margins natin, no? So pwede ganun. Yun ang maganda sa ancillary department systems kasi it gives back money to the hospital. So you have lower cost, you have profit margins, faster. So pag mas mabilis yung turnaround time ng isang system with mas dumadaming volume, and improve on services to more patients. Okay. The fourth one is the clinical IT system or the electronic medical records. So sometimes we get confused what an EMR is, no? Depending on the definition ng mga tao, but I always stick to the definition that EMRs provide real-time access to patient care. It captures data from various clinical sources. It is used by clinicians as a primary information resource. So ang mga sample dyan sa loob ng hospital are the clinical data repositories, no? This is the ability to look at the different results from the ancillary systems. Kaya mo bang tingnan yung lab results mo? Kaya mo tingnan yung radiology results mo? Kaya mo tingnan yung ECG results, no? Into the system? Or do you still wait for paper? No? Kung everything's paper, hindi yan EMR, hindi yan electronic medical record. Okay? Yung mga doctors mo ba, doon ba nag-write ng notes nila? Okay? So, maraming papasok sa loob ng EMR. The HL7 Philippines plans to create to have a different session on EMR roadmap kasi maraming pwedeng i-discuss sa loob ng EMR. One of the most common resources of the EMR roadmap is actually the MRAM model. Okay, so it has 7 stages. I will not explain it right now, but in a different session, we will go through each of the stages one by one to explain kung paano nag-build ng proper EMR roadmap. And it also involves proper phasing of the project. No? Okay. To appreciate the different clinical IT systems, you also need to appreciate the different specialties that are inside the hospital. So paminsan hindi nakikita yon. One of the biggest misconceptions of an EMR is maglagay ka lang ng form, meron ka ng SOAP sa loob ng HIS mo, EMR na yon. Hindi, no? You need to look at the different specialties. Meron ditong behavioral health, no? Psychiatry has a different way to document than ophthalmology, than pedia, than dermatology. The way they do stuff, the way they do things are actually different. So dapat yung mindset na yan pumapasok when it comes to planning for a clinical IT system. Okay? Just sharing na Vista, one of the oldest EMRs in the world, it's still working. It was built in the 70s. And if you look at the different clinical functions inside, napakarami, no? You look at ambulatory care, care management, registries, procedures, no? Yung kanilang data repository. So marami ang papasok sa isang module. Okay? Ang sa akin kasi is, if you look at it, and if we review our implementation of clinical IT systems, if it is not used by your doctors or nurses to provide care, it is not an EMR, it is an HIS. Okay? So ang importante is, ginagamit ba ng mga doktor niyo yun to manage patients. Okay? It's important to look at the clinical workflows. Ang malaking bagay dyan is, would your EMR allow multiple teams to input their notes para yung referral nababasa ng cardio, yung notes ng anesthesiologist, yung notes ng surgeon, itikitaan sila. Okay? It allows for multidisciplinary care. The value and benefits of EMR, evidence show na it improves clinical outcomes, patient safety. No? So we don't need to debate on this one. We already know the value. And in another session, we'll discuss more of this. Okay? So mas mahaba-habang usapan niyo. Let's go to the framework. Back to the framework. The fifth one is actually telemedicine. Many years ago, I put telemedicine as an innovation, something na novel pa. No, but because of the pandemic, we know na it has nasa mainstream na siya ng patient care. So it is part of the usual modalities na natin. Telemedicine is the delivery of patient care and hospital services remotely via IT. Now, telemedicine is not all about video conferencing or yung video call lang. No? So there are a lot of use cases. Even before the pandemic, years ago, there's already different use cases. Ito yung mga diagnostic readings, teleradiology, no? Yan yung pinaka-common. Teleradiology, telecardiology, telederma, telepathology, teleophthalmology. These are the parang store and forward type of telemedicine. You have an image, ibabato mo doon sa isang reader, yung reader ibabato sa yung interpretation. So that's the earliest forms of telemedicine. However, there is also telepsychiatry, online counseling. Ito yung mga video calls dati na mag-uusap lang kayo. It allows for session with the patient. Meron rin yung tele-ICU, and right now, yun sa pinakamalaking and mainstream natin is the teleconsultation. Many years ago, when I was the CIO of the medical city, we implemented yung telemedicine using devices, no? Yung device na dun sa side ng patient. Tapos merong isang assistant doon, siya yung gagamit ng device, tapos yung doktor titingnan niya sa kabila. So we tried exploring this using these devices and putting it as part of our tele-ICU plan project. So maraming pwedeng explore sa telemedicine. But with the pandemic, the DOH has already recognized that it's an important modality. No, it's not the only modality, but it supplements or complements whatever is available for face-to-face. Okay, so recognized na siya. It's important to appreciate na kahit na hindi ka nakabili ng platform, you have ways to make sure that telemedicine works for you. As long as you have some of these components, you make sure that you have the audio video conferencing, you have a way to create appointment and scheduling with a patient, you have a way to accept payments, you have a way to get orders, no? And then access the patient data. Kasi sometimes, even if we have video calls, kung hindi mo nakikita yung past history ng patient, past medical history or records niya, useless kasi nangangapa ka. You waste your time just asking questions kung ano bang ginawa dito, ano bang ginawa, ganun, no? So these components help in making sure that you have a platform that works for you. Okay. So we already know the value and benefit of telemedicine. No? It allows continued delivery of care, continuity of care sa labas. But on the business side, it's also pretty important because it allows the expansion of hospital services and the reach, better patient engagement, and even inter-hospital referrals. It becomes another source of revenue for the hospital. The sixth domain is data analytics. Okay, so data analytics is the buzzword, no? Parang gusto ng marami, no? May data analytics pa tayo. But I want to be very practical about data analytics. Data analytics is nothing more than just data management. As I mentioned, kung na-appreciate niyo, I was going to the different domains, you will see that you have a lot of data in the silos, no, of the different systems. Meron kang patient demographics, billing information, ancillary, clinical, andun na sila lahat. Even the HRIS is one source na pwede mong ibangga with clinical, di ba? So lahat yung mga yung mundo na yan, that is just the management of data. So you look at your data analytics. How do I manage data? How do I generate reports? How do I analyze all of this? Okay, so it doesn't have to be something that you buy. You just need a different mindset when you look at data analytics. Can we do better reporting? Can we extract data from it? No, but moving forward, if you really want a data analytics plan, you need to look at databases and data warehouses. My practical approach when it comes to data analytics or data management is just to understand that there are different steps. Okay, so there are transactional IT systems inside the hospital. So nakita natin we have an HIS, clinic management system, ERP for financials, EMR, ancillary results, laboratory, others, lahat yan sila. They serve a very specific function, which is to record transactions. Transactions sometimes are not optimized for analysis, okay, and dashboards. That's why it's important if you create a plan, you create this second step, which is called staging. No, in this part you have an ETL, extract, transform, load tool, and probably a staging table, a staging database. So ang important to understand is you need to crunch your data. Probably the more systems you have, you need to crunch it outside of the transaction systems. Put it outside. You need to stage it and put it in a data warehouse. Pag nandito na siya, na-process na siya, we'll have a different session on this one, in-depth. No? But what's important is to understand is you need to take it out of your transaction systems, put it somewhere where you could actually stage it, properly format it, transform it, put it into the data warehouse, and then create data marts that allow for reports and dashboards. No? So kung kailangan, dito mo ma-appreciate na, let's say for example, ano yung number ng orders of the LIS, magkano sila with the ERP, and ito yung LIS, and yung turnaround time. So ano yung mga costing. No? If you understand that kind of report, nagka-cut across siya ng different systems. So once you have that kind of need, no, for a data, for a report, you need to understand, you need to take it out and go through the process of data management talaga. Okay, just some sample dashboards. Once you crunch your data, you end up crunching it, you have a better sense of, you can create different dashboards na. No? So you look at ano yung mga visits, census, distribution, no? So mas ma-appreciate na ito. What's important to note about data analytics, especially if you are dealing with mga data hungry or data greedy na management or minsan yung mga CEO lagi gusto ng data, pahingin ng data. Okay, but it's best to always look at key performance indicators. Ibig sabihin, meron kayong tina-target na metrics na ito ang gusto niyo i-monitor. So yun ang i-identify niyo from the beginning. Just because data is there, you don't need to crunch it na gusto ko lang malaman kung ilan yung pasyente taga, for example, Las Piñas, but no? You don't really need to know, no? So hahanapin mo ba yung key performance indicators that would make sense to your business. That's important. Okay, and then from there, you start working on your strategy. You might need to look at data encoding. Ang ibig sabihin ng data encoding is you might need to add more data, no? Sometimes ganun, kulang ito, kailangan ko i-add to. May cleanup nangyayari yan. Okay? So it's important to avoid data overload. So understand what your requirements are, understand your key performance indicators, ano yung nag-matter sa business, then look at it from there and then build the reports from there. Okay? So once you get a better understanding of your data, then it can lead to better marketing and sales, bibigyan yung data sa sales team, improve ang customer service and better cost control. One of the things na na-appreciate ko about data analytics with one of our clients was when we came to analyzing barangay, no? Nagtaka kami bakit yung barangay from yung isang barangay na hindi masyado malapit, mas maraming pasyente doon. Tapos yung ibang barangay na mas nearby hindi. Nalaman namin na yung jeep, yung route ng jeep, mas dumadaan doon sa barangay na yun. Yung iba, magta-tricycle pa, 2 rides, no? 2 rides to get to the hospital, yung isa 1 ride lang, pero kahit malayo, 1 ride lang. Nag-make sense, no? So it made sense. Okay, yung 1 ride pala is better than 2 rides, no? Mga ganung bagay, no? Those are the insights you get when you do analytics based on your HIS information, just on understanding the number ng patients from a barangay. Okay, so malapit na tayo. Medyo mahaba yung so communications and capacity building. This was pretty important during the pandemic. Before I put it inside operational support systems, this is the idea that you have email, no? Yung mag-email ka lang sa mga tao mo. But with the kind of work environment we have right now, we also appreciate that it's almost always that we might need to work on skeletal crew, or skeletal staffing, or hybrid, no? Yung iba work from home. You need to create a plan for this, lalo na kung ang talagang nature ng work ninyo involves hybrid, no? Meron talagang work from home. Dito kayo talaga magpaplano kung paano kayo mag-communicate better. How do you manage email? Before the pandemic, it was parang usual practice na yung mga ibang staff, ibang nurses, wala silang email. So what happened during the pandemic when the nurses and the other staff, the other doctors na sa labas, you send patient information through personal emails, no? Through Viber, through instant messaging. I'm sure napakaraming tao guilty sa point na that we have a lot of patient information within our own personal mail in emails, di ba? So kahit hindi natin aminin, alam natin nandiyan yan, no? So yun actually yung malaking bagay. So if you really want to be forward thinking about your plans in the IT side, you need to consider a better communication strategy, no? How do you manage information? How do you message your people outside, no? So, and even yung idea na e-learning, how do you train them pag nasa labas sila? Pag hindi available in classroom, no? Mga ganun. Okay? So, in terms of communication, the simplest solution is often provides already the great benefits. Simple email lang, malaking bagay na. And sometimes you don't even need to spend a lot, no? Maraming open source na mga solutions na pwedeng gamitin. Okay, but let's not forget about data privacy and patient confidentiality. That's pretty important. Okay, so if you have a good communication and capacity building plan, you get the right things done faster. Okay, hindi kayo walang confusion doon sa organization. Customer engagement is the 8th domain. Okay, when it comes to customer engagement, it's important to understand that we have 5 customers in the hospital. Nadadami pa sila kung ano, but we have patients, doctors, our staff. It's possible that you have companies na and then the public na, so kung paano ka mag-communicate, paano mo engage. We have the website, mobile apps, social media. But this is more on the marketing side. However, on the patient care side, and the health informatics side, we talk about patient engagement in terms of using patient portals. So I'll just highlight that patient portal is already here. No, we understand that some hospitals already allow online payments, and ngayon malaking bagay sa atin that we get our results online. No, so pag nag-RT-PCR tayo, ayaw na natin balikan, no? Uwi na tayo, then we get it through email. Now, those are forms of patient portal that bits and pieces pa lang, no? We need to really build the puzzle into a complete picture, no? From having patients go on board, register, look at their results, look at their documents, look at their records, appointments, no? That's a better plan, no? It's important to look at the patient portal as a plan, no? As part of your roadmap, not just a reactive na, gusto nila magtingin ng lab results, so maglagay na lang ako ng PDF doon, tapos okay na, tapos move on ka na sa ibang projects, no? It's important to look at this in the different light because proper customer engagement improves patient loyalty. Kahit naman tayo, no, kung meron na tayong, alam natin na yung isang lab, isang hospital, andun yung records natin, andun na yung mga dating RT-PCR natin, no? Mas ano tayo, mas gusto natin na doon na lang tayo kasi kilala na natin, no? Kung ginagawa niyo yun, then ma-appreciate niyo ba dun sa hospital niyo? It's something that you also need to do. Why? Because kung kayo nga naging loyal kayo sa hindi niyo kilala, di ba? Paano pa kaya kung yung sa hospital niyo lagyan ng capability that it improves patient loyalty, no? Mas bumabalik yung pasyente just because there is convenience in the way that you deliver the results, the appointments, bookings, everything. Okay? So that's an important part of customer engagement. If you're ready for that one, nadaanan niyo lahat ng ibang domains, then something that you need to plan in your roadmap. The second to the last one is system integration. I put this last not because it is not important, but because it is one of the most important aspects of any kind of roadmap plan, no? We are talking about strategic IT planning, di ba? So you need to look forward 3 years. I'm going to implement several systems, no? Naglagay tayo ng napakaraming systems dito. Kung nilatag mo yan sa iyong roadmap, then papasok sa isip mo na, I need to integrate all of this. These systems need to talk to each other. Okay? System integration is the project, the effort to make all the different IT systems that you implemented talk to each other. So yun ang malaking bagay, no? In terms of the IT systems in this one, we already have an open source engine that we use, but you could use any other integration engine. But the one that we use is Mirth Connect, no? It's an integration engine, open source, it's free. You just need to learn it. You have HL7 and Fire for integration protocols. However, there are also other protocols involved in the integration, APIs, JSON, XML. Okay? The big picture kasi, if you look at it, the drawing na ako, this is the big picture. You will see that you have the core transaction systems, the operational support systems, the ancillary, no, the clinical, the patient portal. As much as possible, all of this should be talking to each other. You have an integration in between the uusap sila. You have an ETL tool that builds to the data warehouse, no? So, pag naintindihan mo, marami pala, no? So, you need to plan for this. This is not easy, but it is doable. It is not impossible. You just need to plan for this. But it's important that you appreciate the big picture inside hospitals. Okay? If you want to go towards clinical, one of the earliest projects is looking at the clinical data repository. The clinical data repository is an integrated repository of the different sources from the ancillary systems. Doon pa lang. Imagine the capability for the doctor to look at the laboratory, the CBC, the X-ray, the ECG, and nuclear medicine in one system. Okay, that's a very big value na dun sa ano. Okay, this is a real-world scenario. I'm sharing this from our previous implementation last year na go live, no? But we tried to implement a system na from a HIS, it works with HL7 compliance systems, no? These are the ancillary, the results, no? May laboratory, PACS, RIS, ECHO, ECG, eye center. So all of these were HL7 compliance system. We integrated with the HIS EMR. However, the reality inside the hospital is not everything is HL7. You need to work with CSV, text files, because you have other data like PhilHealth, ERPs, no? So babato ka dyan. You even have other systems that you don't know how to integrate. Andyan sila. They are silos. No? Sometimes document management system, mga registries, mga mobile apps, even HRS nandito. Okay? So this is just a real world planning na ginawa namin. No? So makita nyo maraming gagawin sa isang hospital. This is a system integration plan. Okay, so it's important na even if we look at HL7, maraming non-HL7 requirements nandun sa loob. And it's important also to note that you don't really need to buy a lot, no? You just need to learn a lot, no? Sometimes kasi may mga free tools that allow you to integrate, but you really need to study it. But the value of integration, it minimizes errors, it reduces cost, no? It is one of the first steps towards efficiencies. So pagka you minimize re-encoding, you minimize errors, it also improves effectiveness. Ang ibig sabihin doon, mas effective yung treatment kasi walang nagkakamali, walang error, and it also allows for innovation. Okay? Kasi for example, you want a mobile app, pero hindi naman integrated. So anong lalagay mo sa mobile app? Paano ka maglalagay ng lab results sa mobile app kung hindi ka pa nakaka-integrate with your LIS, no? So it allows for integration. Nasa last na tayo. This is the other innovations. Okay? So other innovation, this is where we keep an open mind, no? It depends on the hospital, but some hospitals have this parang go, let's experiment, let's look at this new technology, let's look at opportunities, no? So this is where the hospital is very progressive. They create strategic differentiation through IT, no? So even before the pandemic, may mga hospitals na gano'n na, let's build something this one because we want to be the best, we want to be the most digital, no, in our area, no? So this one, medyo ano talaga siya, no? Effort, no? Kailangan meron kang research and development mindset. Okay? Some of the sample IT systems here, if you look at it, is cloud computing. I'm sure not all hospitals are looking into cloud computing pa. No? So they might have emails in the cloud, but not clinical data, not transactions data. So it's something that some hospitals are willing to explore. AI, machine learning, lalo doon sa reading ng ng mga images, no? Robotic process automation, RFIDs, mobile apps, no? In 2021, naglabas sila ng study, the top healthcare trends, no? This is not a trend in the Philippines, but what I do is I look at this and look at the different possibilities. If you look at this, even in 2021, telemedicine is at 12% as a trend, as an innovation area, kasi there are still a lot of things that we can improve in telemedicine. We look at big data, also an area for improvement, di ba? So marami pang areas na pwedeng maging ano. This is not an important part of the roadmap, especially if you have limited budget. But if you have some time, then it's important. Another one to consider is you usually trigger R&D, research and development, because of a specific problem, and you cannot buy anything. Yun ang usually nangyari sa pagka nag-eksperimento kami, wala tayong maibili na isang bagay. So mag-eksperimento tayo kung paano natin pagganahin. No? We look at problems. For me, it's important to make a distinction. If you are just buying stuff, buying a system, even if it's too expensive, it is not innovation. It is just buying. Okay? I don't call hospitals innovative just because they bought something expensive. Innovation in the Philippine setting, kailangan medyo MacGyver tayo. So innovation mo shouldn't cost so much. No? It's something na nag-innovate kami as a hospital because we look at a possible solution and it's actually lesser cost than just buying outright. No? That's innovation that improves. Maraming mga government hospitals, maraming mga hospitals are actually innovating with it, that mindset. Let's look for something viable na hindi masyado mahal. Okay, so the last section after the 10 domains is actually just the IT side. No? If I'm talking to IT managers or hospital CIOs, this is the part where after planning all of those and looking at the different projects, you need to put in the right amount of hardware, workstation, peripherals, no? It doesn't make sense na naglagay ka ng LIS, walang workstation yung mga medtech, no? Mga ganung bagay, no? So this, wala kang extra server, wala kang data center to handle yan, no? Look at the capacity. So this is just part. It completes the framework in a sense that if you're the IT manager, I look at the different, the different plans, and then I put a plan na, oh, I need a server here, I need a data center here, I need, okay? So that's it. Second screenshot opportunity. If you need to screenshot this one, this is the framework. You could transfer this, you could create a table in Word para mas maraming space. That's what I do, no? This is just a way to make it compact. But sometimes I create a plan na nakahiwalay sila in a Word, mas maraming space, nagta-type ako. This is what I do. And then when I put the timelines, maglalagay lang ako ng color, no? So I will implement core transaction systems for the first first 3 quarters of year 1, and then I'll put an LIS dito, no, ganun. So you take out this one, you put all the difference. Kunyari, LIS, meron sub dito, no? You could create a Gantt chart that follows this framework. You can take up the others, no. Use it as needed, but it creates a framework para wala kang nakakalimutan, no. Naka-view ka ng plano, naka-create ka ng roadmap na mas mabuti. Okay, so the benefits of an organized framework is that you have this big picture, nakita mo yung projects mo, budget. You can create a business case for management. Pakita mo, oh, this is the plan, look at this. Does this make sense? Kasi nilagay ko yung business case sa taas, ito yung mga plano, no? Ganun. It also provides clarity of purpose for the team. So the last step is to put everything together. You sit down with your team, try to plan, look at the possibilities, but don't get overwhelmed kasi sometimes marami tayong gusto natin gawin lahat, no? Even the hospital. Sometimes it's not up to us, the IT side. Sometimes it's up to management. Sabihin mo, kung nilatag mo yun, okay, kung ginamit mo to ng buti, tapos nilatag mo yung mga projects sa bawat isa, ma-appreciate yung management na you're actually implementing 10 systems all at once, no? So hindi nila nakita kasi minsan pag paisa-isa yung usapan, hindi nila nakita that it takes a lot of resources to implement 10 projects all at once. So pag nilatag mo yan ng mas maayos, nakita mo na dito, then makita na, okay, i-move natin yung iba, no? It creates a good discussion point, no? A business case tool for IT. Okay, so that's it. I hope it was helpful. Thank you for your time. If you have other questions, you can email me. But these are question and answer section. And then you can visit us at Facebook at HL7, Facebook/HL7PH.
Okay.
Questions?
Thank you, Dr. Mike. Questions, we have a couple on the comment section po, no? Very important, and I think this is the one top of mind for our audience. How do you fill out that the roadmap? What do you actually put there?
Okay.
Is it a Gantt chart or do you actually put content there? Yun po.
Yes. So ang ano ko dito is once you have this, it depends on the Excel sheet, no? Usually pinapalaki ko to and I put the key business strategy objectives. You need to work with your business. Sabi ng business na actually this year we plan to open a new hospital. Okay. Ano pa? And then for the old hospital, we plan to put in a new OR system and a cancer system. Okay, so nilalagay ko yan paminsan dyan. Tapos siyempre, and we want to get more revenues from home care. Okay, so nilalagay ko dyan dito sa business side, no? Then second, dito sa second one, nililista ko siya na bullet points. So lagay nyo sa Word, no? If you do it like this in an Excel, masikip yung lugar na yan. So lagay ko siya sa Word, no? Tapos dito sa IT strategies, ito na yung internal kasi sometimes na you need to be realistic. Sabihin mo ba na actually sira na yung data center natin, so ilalagay ko, I need to buy a data center. Second, sabihin natin na ang focus natin is really integration. This year is also integration. So ilalagay natin dyan, no? Hindi na-appreciate ng management yun. Walang pakialamang business, ha? Ano ngayon kung mag-integrate ka dyan kasi hindi tangible sa business side. So ang gagawin mo bali is ilalagay mo dyan yung mga IT side para it also provides visibility, no? Doon sa sino man titingin ng framework. And from these two, from the top two, pag medyo malinaw na sa iyo, ilalagay nyo na yung mga plano nyo. This one is like a header of several systems. So pagka malinaw na mag-implement ka ng HIS, then open mo to, kung sa Excel pa yan, insert a new row, maglalagay ka ng HIS dyan. Tapos lalagyan mo ngayon ng Q1, Q2, Q3. Usually 6 months ang HIS, 6 to 9 months. Ganon. Tapos dito sa baba, ancillary, maglalagay ka ng LIS, RIS. Sabay sila. So implementin sabay. So lalagay nyo sabay niyan. Sa operational support systems, maglalagay ka ng HRS, no? Pagka nilatag mo yan according to this header, no, lahat sila, tapos yung bawat system or yung kung may product name na, no, sabihin natin na ang product nyo is Cerner, no? Mayaman kayo, naka-implement kayo ng Cerner. So dito kayo sa clinical, Cerner EMR, no? Naglagay nyo dito 18 months, no? Pag ganun. Pag nakita niyo yan ng sabay-sabay sila, makita niyo, wow, overwhelming. Malaking bagay ito because there's always, para sa akin, there's an organizational capacity for IT projects. Yung isang organization can only handle specific number of IT projects. Kaya kailangan nakalatag siya. Usually, 3 major, 2 to 3 minor projects. Usually, ganun, busy na talaga yung IT niyan. No? So, pagka 3 major, 3 minors. No?
Okay. Thank you, Dr. Mike. Question, how about HMIS, the Health Management Information
Dito
System?
siya sa core transaction system. Baka late. That's one of the earliest na ano, na domain. So the core transaction systems has the HIS, the clinic management system. So nandun siya actually sa ano. Sa first pa lang, that's one of the core transaction system. It's one of the first that you implement because that's the one that you need to track your patient journey.
Okay. Next question, Dr. Mike. If you go, if you would be kind to go to your trends and innovations slide,
Okay,
sir.
okay.
Question, ano po ba ang mga use cases sa Pilipinas bukod sa pagbabasa ng images and blockchain, at least for the Philippine context?
Actually, a few days ago, I had a discussion with an HMO and an insurance company, and they admit that they are sitting on top of a lot of data. No? Even just the idea that you could look at the trends, case mixes, no, yung predictive na ano bang mangyari, even the surges ng mga diseases. Actually, nandun sa kanila lahat yun eh. If it is properly documented, nandoon. But since a lot of stuff is still in paper, hindi natin na ma-maximize. So we could really look at that area as one source, no, of ano. From there, marami tayong pwedeng makuhang ano, predictive analytics and AI na pwede nating matingnan. Okay.
Okay. Sige. Dr. Mike, how, if you can go back to your roadmap again, I'll try to consolidate po other questions. How do you marry yung business strategy and the IT strategy? Sometimes the IT department has their own strategy that may not necessarily parang nauna sila kaysa sa business strategy, but obviously the C-suite people have their own business strategy. So how does the reconciliation end up?
Yes, actually, that's why this tool is pretty important. If you put them side by side, nakikita, no? When you do a report, sometimes I put a report na we cannot avoid human nature in a sense. And part of human nature is some people will have pet projects. That's one. The second one is, sino yung pinakamaingay sa loob ng hospital, siya ang nabibigyan ng budget. Okay? That's a reality. Now, lalo na kung mga doktor na diva. Paminsan diva, no? Okay. But ang ano kasi dito is, if you create a framework that allows for visualization of the alignment, they cannot deny it. So let's say gusto ko ng pet project na mag-create ng registry on something na gusto ko malaman yung preferences ng customer. However, look at this business. We need to expand and go to home-based care, no? We need to look at cancer services, no? Pag ganun. Then pag nilatag mo ng mabuti yan, that's where alignment comes in. This is not a one-shot deal lang, no? The whole framework is an agenda, a starting point for discussion, and you should iterate it with management. This cannot happen in a vacuum na ikaw lang nagpaplano. No, you need to work with management. And that's where alignment comes in. Ito po yung plano ko, ito po yung nakita nyo, ito yung ano. Tapos ito yung mga projects na nakapila. Ito po yung pinipila po ni Doc ganito, ito po yung pinipila ng department na ito. Ito yung ano. So makita nila ngayon. And that's where they come in kasi if kung meron talaga yung proper budgeting sa hospital, titingnan nila yan. This cost how much, this cost how much. So kita, okay, mas priority to. And then ang reality, sometimes even there will be some points of misalignment. I would consider it mga 10%, no? Sometimes na doon papasok yung pet projects and human nature na project. But that's the reality. It's okay. As long as you maximize your 80%, your 90% aligned and everything goes back to the hospital and there is value, okay na tayo doon.
Okay, thank you, Dr. Mike. Another question. How ready are we in integrating private EMRs and public, the government EMRs, as a way forward for the creation of the healthcare provider network na nasa UHC?
Agree. Actually, that's a very, a very important question. And it's not an easy question. It's not a question that's easy to answer. No? So, marami kasing points, no? Maraming steps. What's important is the different nodes are working to improve themselves. But there's also this mindset na looking forward, we also need to integrate. Kasi uh, mahirap kasi kung we depend everything on government. Maganda rin kasi yung private side, meron silang sarili nilang efforts, no. We are not, I don't want to say that we are not ready, but we are getting ready, no. There is already a hunger in a lot of hospitals, clinics, not only because of EMR, but because of the pandemic, of the nature of patients that we have, the nature of environment, the world that we live in right now demands digital, no? Can you just imagine if you need to go to your bank na mag-deposit ka pa at kasi kailangan mo pumila, no? Kung ganoon nga rin tayo sa ibang aspects ng mundo natin, hindi na nga tayo sanay na magpila na rin paminsan sa restaurant, no? Mga ganung bagay, no? The pandemic has put everything in rapid pace ng digital transformation, no, in our lives. Karon na rin ng healthcare dapat. So it's not that we are not ready. Everyone is getting ready to it, but sometimes we just need help from each other, no. That's where HL7 Philippines comes in, no. We try to help in terms of the integration, but internal we also need you also need to do your work in terms of coming up with a good plan, no. Then government also needs to come up with their own work that this is our vision for the nation, no. So everyone really needs to work together on this.
Okay. Thank you so much. Okay, if there are no more questions po, no, we would like to thank Dr. Mike Mewin for really sharing your extensive knowledge po on the subject, just to borrow from one of our audience. Dr. Mike, just a parting message po, no, is there if there's one message that you would want to impart to our audience from your presentation, what will it be?
I think it's important to look at it. The strategic aspect of strategic planning is trying to solve problems and alignment with the vision and the resources. We always work with limited resources. That's why it's important to maximize what we have. So that's being strategic. So thank you, everyone. I really appreciate the questions. If you have other questions or comments, please email me or let us know. No? Nasa online naman kami.
Okay, maraming salamat po. If you could be so kind as open up your videos po just so we can document this webinar. But thank you on behalf of our audience po, no, Dr. Mike, maraming salamat. And we look forward to our next webinar. Our next webinar po will be on August 5th. That will be 2 Fridays from now. So if we'd like to ask everyone on the Zoom to open up your videos po if you can, so that we could take a very quick photo. Dr. Mike will take a very quick photo po.
Mukhang shy yung
Open
iba, shy.
video. How do we allow video? Dr. Mike.
Sandali ah. Baka naka-ano yung
Can
security.
we allow video? Sige, sir.
Ayun, okay. Sorry.
Sige po. Please try again. So what do we can have you on the screen. Can you open up your yon? Okay. Sige po. Subukan nyo lang po mag-open ng video so we could take photos of the group. Okay. Okay. Sige po. We'll wait for 10 more seconds. May mga... Okay. Sige po. 5, 4, 3. Bukas na po yung video sa 2, 1. Sige, Dr. Mike, go ahead. We'll take our cue from you.
Okay, 1, 2, 3. Okay. Isa pa. Okay. 1, 2, 3. Okay.
Okay,
Thank
maraming
you.
salamat po, and really thank you so much. We learned a lot tonight, Dr. Mike. You will see the clap emoticons on the ano po, no? So
Thank you.
thank you. And we'll see each other again on August 5th at the same time at 8 to 9 for our next webinar from HL7 Philippines. Please feel free to visit our website at facebook.com/HL7PH. Thank you. Magandang gabi po and have a good weekend.
Thank you. Good night.
Thank you, Dr. Mike. Thank you, sir. We can stop the
Thank you.
recording na yata, sir. Okay na.
Oo.
Okay. Thank